The number one thing when you see like elbow pain, you should think they're doing too much. The general goal of today is upper extremity training, upper extremity rehab, a little bit more focused on elbow, hand, and wrist stuff. But it's really important. I think it matters. I think you will see people with it. You'll definitely see a lot of elbows, whether you're prepared to treat it or not. And a lot of the stuff ties into using everything as a whole, right? It's not just like, I'm just gonna do elbow stuff. Just like if someone comes in with knee pain, you're not just gonna give them one quad exercise and call it a day. Maybe, but typically not, right? From my experience, a lot of people get elbow rehab wrong. They miss the boat and they get too hyper-focused. And there's, I think, two really big errors that people make. One of them is something that we talk about here at Reload all the time, which is programming. And the other thing is getting way too specific, giving them just wrist stuff, just elbow things, and not understanding that like oftentimes like that's probably not what they need, or that's probably not gonna really move the needle quite as much as you want it to. The other component is that it's really, really boring to just have someone sit there and just do a wrist exercise. But you don't need to be there for that. They hate it. No one's gonna go home and look forward to just doing some wrist extension curls, wrist flexion curls, and some pronation, supination. For the right person at the right time, that could be really appropriate. But generally speaking, it's probably like not enough intensity, and it's probably gonna be a low adherence to it because it's just not as interesting and engaging. Yeah, so I think the biggest thing is gripping, right? So when you're gripping, when you're grabbing something, you have to use both sides. So you'll see that like a lot of people with elbow issues are constantly grabbing something, right? The other thing that's like super big is like, what do these people do, right? They just do a lot of everything. The common thing is like tennis, golf, right? Anything that has like repetitive elbow movements or repetitive gripping is where these things come up really, really frequently. And oftentimes you're just doing so much of it. And it's hard to tell someone, just like it's hard to tell someone not to walk, right? Because they're like, their plantar fascia hurts or their foot hurts. It's really hard to tell someone like, oh, like you need to do less grabbing. But the number one thing when you see like elbow pain, you should think they're doing too much. And that's where you really have to start to look at like programming. And you have to say like, what are you doing? How much of it are you doing? How often are you doing it? And it's not just to say, oh, I do this a couple times a day. Like you have to know exactly like the weights, the reps, the sets. I think climbing is a really good example because people climb, which is grip, 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 and then they hear strength training is good for climbing. So now they're deadlifting and they're rowing. So now they're adding grip on top of grip on top of grip, and they're wondering why their elbow hurts. And it's like, well, have you ever tried not gripping as much? which is hard to say, but it's the reality of it. And the other component is that like they think like, oh, I wasn't in pain, so I was doing this, I was doing all these things. I was playing tennis 5 days a week, and I wasn't in pain. I'm in pain, but not realizing that like their normal was probably too much to begin with, right? So maybe 5 times a week was already too much. So they want to get back to it, but it's like, well, maybe let's just get you back to a little bit. Frustrating thing about elbow pain is that it's oftentimes pulling back a little bit because that's oftentimes overuse, but it's also like something where like the research supports that nothing's really good for it. That's the other frustrating part, is so there's no good intervention for elbow pain. Exercise is not like really, really great. It doesn't hold up well with the research. Dry needling doesn't hold up well. Massage doesn't hold up well. Like acutely, yeah, it can be good, it can be beneficial, but most of it is just like activity modification. And that's really frustrating when someone comes in and they see all these exercises on Instagram, supination, pronation, flexion, extension, and they're like, yeah, but like I saw like this athlete or this person on Instagram telling me that like I have to do this if I have like medial elbow pain or lateral, or like this fixed my medial elbow pain. And it's like, well, like that might have worked for them, but it's probably not going to work for everyone, and it's clearly not working for you. And usually these people have tried it already and it hasn't worked. And it hasn't worked for a lot of reasons. One of them is like it's just probably not enough intensity, even if it is a tendon thing, but the biggest thing is the volume. Any athlete, like the thing they care about is like doing the sport, right? So if it doesn't look like the sport or feel like the sport, they're gonna be less engaged. And they also want to feel tired and feel like they worked hard. So like the issue is like elbow is gripping and repetitive flexion. Like those are the two things that you'll see are like provocative movements, right? So then you want to think about like, well, how can I get them to lift with less gripping, or how can I get them to train with less repetitive elbow flexion? And that's where you can get really creative. But like, you just think about a pull-up. If I do a narrow grip pull-up, my elbow is gonna be more flexed. If I do a wide pull-up, my elbow is less flexed. There's a good chance that as someone who's sensitive to elbow flexion is gonna feel a lot better with a wide grip pull-up or wide grip push-up. There's just less elbow flexion, so there's less torque, right? So you're still giving them the training that they want and that intensity that they want, and the exercise that maybe that they want to keep doing, but now you're just being mindful of the fact that like, okay, like it's a little bit less stressful in the elbow. So now they're happy. Maybe that's not going to be the exercise that like is going to like move the needle. Maybe it is, but at the very least, it's going to keep them really engaged. And that's how you can start to make those modifications to allow somebody to get some sort of like adaptation through exercise potentially, or to continue to maintain the things that they want to maintain, which is like their fitness and health.
Yeah.
Keeping it simple and getting their attention onto like the bigger picture with elbow pain is really important.